He reports more than 90 cases confirmed in the first week of December alone. That's more than double the cases we've seen that same week over the last 3 years.
This morning, a holiday health warning as cases of the norovirus surge. New data from the CDC shows an increase in outbreaks, with 91 reported in the first week of December across 14 states, more than double the number for the same week over the past 3 years.
Gathering together, especially this time of the year, and all the traveling we're doing, that's causing the increases.
The highly contagious virus, commonly referred to as the stomach flu, can cause days of vomiting, gastrointestinal problems, and fever. Health officials say the number of outbreaks are twice what they usually see. California officials also investigating an outbreak involving 80 people who became ill after eating raw oysters at a Los Angeles food festival. And on 3 different cruise ships operated by Holland America and Princess Cruises, more than 300 passengers contracted the virus. Norovirus can be spread through direct contact with an infected person, touching contaminated surfaces, or eating contaminated food. Now, with millions expected to gather for New Year's Eve celebrations, health experts say it's important to take precautions. Wash produce thoroughly, don't share utensils, and don't rely on hand sanitizer.
You know, we all have this around the house, the hand sanitizer. This does not work very well for norovirus. You need to wash your hands, that 20 seconds we always talk about.
Contagious. I mean, it takes very few viral particles to transmit this, and this kind of runs through like wildfire in communal living spaces and nursing homes and cruises. This is why you're seeing such a rise, and within families it becomes harder too. So that transmissibility, the contagiousness adds to it. But if I were to guess, I think there are a couple of reasons that I can imagine why. One, there's always a surge in the winter. It's possible that we haven't seen as high a numbers in recent years because we weren't mingling as much for a few years during the pandemic. And, you know, now we've changed our behaviors. Potentially we're not being as vigilant as we should be with washing our hands, disinfecting surfaces. And second, you know, maybe because we haven't had as many outbreaks, potentially we don't have as much immunity to some of the strains that are transmitting. Those are some of the thoughts I could think of, but we don't have a definitive answer except for the fact that it's very contagious, but very easy to protect yourself. If you keep your hands clean and keep the surface, not sharing utensils is another way to protect yourself as well. Patient is death because you know we've gotten and built up immunity over the years, and people have been taking the COVID-19 vaccines. But if you want to stay, you know, particularly if you're somebody who's vulnerable or you have someone in your family, everybody over the age of 6 months should be taking a flu and COVID vaccine. If you haven't taken those vaccines yet, there's still time. The flu season is a little delayed this year, but the cases are ramping up, and so you should take it now so you can be protected for the rest of the season. For RSV, if you are someone who's over 75 or someone who's medically vulnerable between 60 to 75, you should have gotten a dose last year. If you didn't, you should get one this year. If you got one last year, you don't need to repeat it. It's still worth it. I would take it because it keeps you from getting more severe disease and potentially end up in the hospital.